At this point, it's time to scrub in or perform a sterile scrub so that you can use the sterile supplies you've opened to continue setting up for the procedure. Double check that you're wearing a mask, a scrub cap, and eyewear. Make sure your sterile gloves are already open before you scrub in. You won't be able to touch the outside packaging after you've completed the sterile scrub. In most office settings, a chemical antiseptic, typically a combination of alcohol and chlorhexidine, is used to rid the skin of any bacteria. It may come in the form of foam or gel and should not be used with water. This would dilute the product, making it ineffective. The use of this antiseptic agent and donning sterile gloves, which I'll demonstrate in the next video, is the transition between a clean, non-sterile person to someone who is sterile or scrubbed in. Start by dispensing the chemical into one palm. Use enough product to adequately coat and saturate your hands and forearms. The amount depends on the product. Refer to the product label for more information. Dip your fingertips into the product and swirl them around to get the chemical under your fingernails. Then transfer some of the product to your other hand and repeat. Next, rub your hands together, coating all of your fingers, hands, and forearms. If you don't have enough and need to get more, whatever part of your hand or fingers touches the dispenser needs to be recoated and rubbed in. Once the solution has dried, you're ready to don sterile gloves. Sterile gloves are the only object you may touch. If you come into contact with any other object, you must repeat the scrub. Also remember, the sterile field is only the area between your waist and shoulders, so you must keep your hands in that area. If you're new to scrubbing in, practice doing it and have someone watch you prior to a procedure day. You'll perform a sterile scrub prior to setting up for the procedure and again after you bring the patient back to the room and perform the surgical skin prep.